The Bundibujo strain of Ebola has a case fatality rate of approximately 50% and currently has no approved vaccine or specific treatment. Given Uganda's proximity to the epicenters and strong cross-border linkages that include trading, movement for other economic activities, and direct flights, the risk of further importation remains high. And so high-risk areas have been identified, and these include all the districts along the western border, the refugee hosting areas, and Kampala Metropolitan because of those two that had come through. And for emphasis, allow me to read these districts. These include Kasese, Ntoroko, Bundibujo, Kabarore, Bunyangabo, Kisoro, Chikube, Kamwenje, Chegegwa, Hoima, Bulisa, Wakiso, Kampala, Chiriandongo, Lamo, Isingiro, Arua, Nebi, Pakwach, Zombo, Moyo, Koboko, Maracha, Yumbe, Obongi, Madiokol, and Kanungu. Some of these are categorized as very high risk, especially the ones that are directly in connection with DRC. The other group, like Kamwenje, like Chiriandongo, like Chegegwa, those are characterized as high risk because they host the refugees. And as you may know, that quite a number of those refugees are Congolese. So in response, the government of Uganda, through the National Task Force, chaired by the Vice President, we want to communicate further measures as follows. The government is going to intensify mass risk awareness and sensitization on infection prevention and control, and observation of the mass gathering SOPs issued by the Ministry of Health for the entire country. This we are going to be using radios, TV, social media, and all institutions that are at our disposal, like cultural institutions, religious institutions, and all local government structures. Number 2, we are going to enhance screening. We've been doing that from the time we reported the epidemic, but we are going to double the screening, testing, and also we are going to enhance treatment capacities along the DRC borderline, and we are going to continue carry out the risk assessment, and based on that we will establish additional testing center to shorten the turnaround time for those that will be suspected. Number 3, we are temporarily suspending all cultural celebrations, commemorations that attract big numbers of participants along DRC Uganda border. And this particular one, we know that the Obudingia will be celebrating their anniversary, their commemorations, and we are advising that they postpone this until we are out of this. As you know, Bundibujo is right next to DRC, and therefore that will cause a lot of mass movement. So we are advising that we postpone that function. We are temporarily suspending the public passenger services on ferries, on Semliki River, the cross-border bus transport, and all public transport between DRC and Uganda for 4 weeks. But this with the exception of goods and food and any other cargo that is being transported across the border. We shall be able to reconvene and continue assess the risk, and we guide accordingly.